Okay, so again, good morning, good afternoon, good evening to everyone. Uh, my name is Marek Wasiluk. I'm from Poland and I'm working actually in the international environment. I'm doing different things, but I'm very deep in the AI and new technology in the medical field and especially medical research field. So I want to share with you some thoughts and some interesting data about the AI implementation in medicine and medical science, just to answer the question which I put in the title. So, is it excitement, or we should have some caution and be a bit careful about the AI replacing doctors, because actually that's the things which I'm talking about. So it will be very briefly because we don't have too much time. So I will just start from. I will just start. Hopefully it will work. Yes. So you should see on the slide. So if we look and think about AI, what we know, what we see, how it helps in many areas, many business or life, our daily life areas, we could realize, or we should realize that AI is really perfect for the medical field, for the medical doctors, for to support them or even substitute them from the diagnosis and treatment of the patients. Why? Because there are two main factors which all the medical or healthcare system is facing. First one is that there's a huge amount of knowledge for a doctor to be a good doctor. It means not only the studies, but then the specialization, the practice. So it requires, first of all, many years of education, many information to have in brain, and then all the time improvement, trainings till the end of the life. And this costs, it costs a lot of, or it requires a lot of time, but also financial investment from the government side, because doctor is a huge investment for any government to educate a good doctor. So if we take into account second feature, that the medical data, the diagnosis of the patient and the treatment of the patient, this is quite reproducible data, a lot of data to analyze. But then once you divide it into small bricks and you put all together, even if it is complex and complicated, but follows really recognizable patterns, which are really supported nowadays, but by different type of algorithms and protocols. So having all in mind, we should think and should be almost confident that AI should easily replace this part of medicine. Maybe not the surgery, although with the robotics virtual we'll never know, but this, let's say, brain part of the doctor uh, mm, should or could replace. And there are actually main five areas where the AI has already been implemented in the medicine. First one is the scientific research and discovery. So AI is very often now used to analyze retrospectively different data about different drugs, for instance, to see if there are any other potencies and possibilities for other indications that they have already been used. Or AI is looking for the combination of different type of products, having knowledge about mechanism of human body functionality, physiology and pathology or pathophysiology, what type of theoretical drug or working on what type of receptors, certain type of mechanism could work for different type of diseases. So this one is done mainly by the industry, by pharmaceutical industry or startup biotech companies. Second part is pure diagnosis. I will talk about it a bit later. Uh, but of course, this is pretty clear that AI is very often and more and more common use to support the diagnosis of the patient. Third one is the treatment recommendation, so suggestions what type of treatment for that patient could be or should be the best. Fourth one is patient medical support. This is something not for medical healthcare professional, but for the patients. So we have huge part of the business
Excuse
actually.
me, sir. Can you
Yes.
please change the slide? It's on the first slide still.
Yeah, but this is, I think this is fourth slide at one moment. Is it moving or not? We find just
No,
switching
it's still on the first slide.
because I'm switching from slide to slide, and that's very strange.
So you
Um,
can share it once again if you want.
yeah, I will try. So there must be some technical things. Mm. So do you see the arrows on the slide? Because I don't know what you see actually.
We can see the first slide.
Just one moment. Okay, so I will I will check one thing and come back to you. Mhm. One moment. But I think it was correct. This is at least my understanding. But just one moment. I will try that way, and maybe I will be able to say it. Yeah. So no, I switched something, so should be
Yes, sir.
okay.
You
So
can see it
yeah.
properly.
So I started to talk about the patient medical support. So you know all these wearables when you can have actually almost live data on patient health condition like blood pressure, ECG, etc., and can be remotely transported, transferred to the center who can which can actually monitor that almost live. So this is different totally type of the medicine and healthcare system. And administration part for huge, especially organization, hospitals, etc. I'm not going to talk about it too much because this is something which is really not relevant. This is more to make it simple to find some information, organize some information, store, and search and seek for data if needed. Just a moment, because now I cannot switch to another slide, so another technical thing. Why it is like that? Yeah. So there's another one. So probably you have heard many times from press release, from internet, etc., that there will be no any more radiologists needed within few years. Even lately, I talked to my colleague and he said that he read article that by 2035 there will be really no radiologists for and all AI will do all the things. All the pathologies with looking at the histopathological slides will be replaced by AI also very soon. So there are many rumors about that. And of course, AI gives some opportunities and huge opportunities for the healthcare system. So with radiologists, of course, we can learn or feed the AI with plenty of CT scans or MRI scans, and based on then if there's a new patient, new case, it can be quickly, rapidly, within really seconds, compared with the database which is in the AI model to see for pathologies, the same with the histopathology slides where you can just have huge database and based on that you can see if the slide is normal, pathological, any cancer, any other pathological signs of pathological in the examination in the slide. I can give you as an example dermatology one. So this is just not the only one, but there's MedGemma. This is the model, the AI model with actually LLM or VLM model, which has been launched and shared by Google for free. to everyone, and it contains 10,000 of clinical cases from the dermatology, 50,000 of skin images of different skin pathologies. I mean that there are 136 different skin pathologies and conditions included in this 50,000 of images. So how it can impact the, let's say, the local, simple or just common dermatologist, uh, you can read below. I mean, if I did some math, so if, let's say, dermatologist sees 10 patients per day, to see this 50,000 different skin images, it would take him 25 years. So having such a model with the AI and with the and connected to your practice, you can quickly make a picture of the patient and ask AI to compare to see if it is similar to anything or not. And having experience of, I don't know, 2 years or 3 years being a dermatologist, you can quickly and easily get some good hints, some good suggestions and recommendations about the pathology you have with your patient. So this is really huge, and this is really uh, great support for doctors. Uh, but the question is it really a revolution or is just a hype? Why? This is I will try to show you and to explain you why. In December 2025, there has been an interesting publication published about the LLM in medical field. It was published in the UK, and it was that all the study and research has been done based on NHS primary care. So they evaluated several thousand of the EHR, and based on that, they took just 277 patients with different type of diagnosis and the proposed medical intervention, and on the selected 277 patients, they put it into AI model just to, how to explain it? Just giving some signs and symptoms patient had and medical history, asking AI for the diagnosis and the proposed intervention, medical intervention. And on the other hand, they compared what the expert, experienced clinician would or will actually would propose for that patient. And what was the outcome of the comparison because between the AI, let's say, model, so AI doctor, let's say, and the real experienced doctor? So in terms of the identification of medical issues, so the diagnosis of the patient, the AI was 100% correct versus the experienced clinician. So there was no any issue, no any problems to diagnose what the patient suffered from, what the signs and symptoms was about. But when we move to the proposed treatment, medical intervention, the AI only in 47% proposed the correct intervention. Correct, I meaning which experienced clinician recommended or actually prescribed to the patient. So I think that this means that we have some issues. And what are these issues? And why are these issues? I want to explain you very short. I mean, the issue is not that AI is bad or that it's mismatching data, but AI is very, very technical oriented. So it's lacking several things. This is the contextual reasoning problem with AI. So it can only make decision A or B or C. So that's the main problem. So applying standards, or AI applies standards without adjusting actually the individual patient context. For instance, recommended really for termination patients with age of 95, the treatment very invasive, very painful. This is just an example which really did not make sense. Or other example that for elderly patients with some renal failure, but not very dangerous, mainly due to the age, proposed strong treatment against renal failure, while there were some more significant or more serious diseases for the patient. So AI is not able to think how the human brain or the doctor brain can think and apply standard without adjusting individual patient context. And also how without understanding how we in practice implement the healthcare to the patients, because there are many differences between also countries or the ages and even hospitals. So uh, what are these limitations about the AI? So first of all, and why there is some risk when where we would blindly look at AI and try to replace doctors by AI. First of all, AI is very often used as a black box oracle, meaning that that everyone tries to believe that there is something which is really great, and we don't really understand most of people how it works, what is inside, but we believe that because this is AI, so this is what AI says must be true. But it is very often not validated with against local data, guidelines, and as I said before, patient context. Secondly, AI is trained the same way like the doctor is trained. The difference is that we don't know on what type of data or data sets the AI is trained. So it can be differences, and there are differences between the races, the gender, the socioeconomic status, or even geography. And if the AI is not trained properly, the results on the diagnosis or the treatment will not be correct. Third thing is that we connected with this with the second one, that we are really lacking transparency with these black boxes oracles. So we really don't know, and patients might be afraid that someone virtual with no name, no any trademark, anything is putting diagnosis. So is it correct? Based on what? True or not? And of course, there are some other things like data privacy, data quality. So real world is totally different from the theory. So just to sum up, because I know that we are running a bit of time, that please keep in mind that AI is really a great tool for a doctor, but at this stage, this is really a supporting tool, and it will really take time until the AI will replace doctors from his job. Thank you.
Thank you, Dr. Marek, for such an informative and thought-provoking session. If any participant has any question, they can raise their hand. So, as there are no questions at this moment, thank you so much, sir. Thank you so much.
Thank you.